My name is Dave Aboulafia. I'm a hematologist, oncologist, a cancer specialist at Virginia Mason Medical Center. I chose to work in hematology and oncology because it's a field that's expanding the most rapidly. The ability to help patients has grown considerably, and I knew that when I started the field. That's where medicine was moving in the future, and that's where I felt I could make the biggest impact in helping people. One of the most dramatic things that can happen, and the way that we often see our patients, is that they go to their doctors feeling well and for routine blood tests, and they get a call later that day or the following day saying there's an emergency and there's something really wrong about your blood tests. And typically we will get those patients within the day and bring them into the clinic and evaluate them. And I think in all of cancer care, leukemia, which is the type of cancer where blood cells grow uncontrollably, is the most dramatic and the most scary because it's the cancer that can grow the fastest and the one that we need to marshal resources around the quickest. So again, for some things, it's obvious that the patients have been slowing down, they've been losing weight. Leukemia tends to, at least if it's acute leukemia, tends to come very quickly. And for that, we really need a quick and responsive team to help out. One of the things that I think is so impressive about Virginia Mason and what really does make a difference than most places where people get their medical care is that there's a dedicated and consistent team around that patient. And so your provider, your medical oncologist or hematologist is going to see you every day. He really does captain the clinical course and helps make decisions with you. And although there may be other members of the team, that primary relationship between the cancer specialist and you doesn't change even when other members of the team may come in and out of focus. So someone who knows you really well, knows the issues, know what happened 2 weeks ago and what likely will happen in a week, makes an enormous difference than I think certain other places where every week there's a new doctor who comes in and you're basically telling your story over and over. And I think with that over and over story, certain details that can be very important get lost in translation. I think that there are a couple major ways that we are really strong, that we have a tremendous team of individuals to work with. We have a core group of support staff. We have nurses who do nothing but cancer care. We have therapists who work only with cancer patients. We have social workers who are really aware of the huge challenges, the financial burdens that go into a cancer diagnosis, and trying to help with that on the front end rather than after patients are left with more enormous bills and hardships. Another point I wanted to make is that all of our patients are presented at a tumor board. And that tumor board is made up of experts in the field, and it's a multidisciplinary group. So I'll be there, but so will all the colleagues in my group. And when I look around that table and when we start presenting cases, it is really amazing to see the depth of experience that sits at that table. So we have physicians who've been at Virginia Mason for 25 plus years, and we also have younger physicians who've been there for now 4 years. And between the young and the older physicians, we really get a full width of input. And I think cancer care is something where it does help to have experience. Yes, you do want someone who's come out of a very good fellowship, who's been well trained, but the clinical experience isn't something that comes overnight. It takes years to master that. And having a core group of physicians who sits around the table as equals, talking about the cases, thinking about what could be done better is enormously helpful. I think the other thing that's really important with cancer care is that when you come for either a primary or a secondary opinion, you're also having your x-rays, your blood tests, your blood films reviewed also. And in a field like leukemia, lymphoma, myeloma, it is incredibly important to have a team of pathologists review those slides too. Your physician may be the best in the world, but he's only as good as the interpretation of that material. And so having someone who's going to look over the CT scans, the blood films, getting expert input into that decision-making is really important too. And so when we sit in that conference, we have a closed-circuit TV. The microscope is attached to this large-screen TV. We all see what the pathologist is seeing. When the radiologist reviews the X-rays, the CTs, the PET scans, the MRI scans, we're all looking at those films together. And having that multidisciplinary group available to trade ideas, to come up with plans, I think also really sets the group apart and above many others in this field.